questionnaire today. I'm going to do a musculoskeletal and neuro exam on you. Is that okay? Mm-hmm. Okay, great. So the first thing I'm doing is I'm assessing the patient's general appearance. I'm looking at their joints, seeing for symmetry, looking at their skin, making sure everything looks pink and normal, looking at their hair. Do I see any open lesions? I'm looking on both sides, and I'm also looking posteriorly, making sure everything looks normal. I'm also looking at body movement. Do I see any like tics or tremors? How does she present? Looking at like the muscle bulk, seeing if I see any atrophy, making sure everything looks symmetrical. So I'm going to assess your shoulders. So can you please shrug against my hands? Good job. And then can you bring your arms out like this? Good. I'm going to press down. Resist me. Good. I'm going to have you go like the T and come up and down, and I'm just kind of looking at your mobility of your shoulders. So any pain? Mm-hmm. Okay, you can relax. So muscle tone was +5 strength. I'm going to do a Hawkins test, so I'm going to have you hold your arm out like this, and I'm going to rotate it out. And do you have any pain with that?
No.
And I'm assessing your shoulder impigmentation when you do that. And for the Jurgensen test, I'm going to have you kind of bring your arm like this, 90 degrees, and I'm going to have you supinate your palm kind of inward. And I'm also checking when you do this, like your bicep tendon, to make sure there's no, to make sure it all feels normal. So now for your elbows, I'm going to have you go like this again. And can you push up against my, yep, and then down? Good job. +5 strength there. And I would do a hook test too if we had any elbow pain. So I'm going to bring up your shirt here. Good. I'm going to bring like this for me. And I'm going to have you clench your fist and engage your bicep. And I'm going to hook my finger under that bicep tendon. And that would be the hook test. And then for the milking, I'm going to have you do the same thing and bring your thumb out like this. And I'm going to pull your thumb while I push your elbow inward. Good job. That's the milking test. And I would, of course, do these on both sides. Next, for the wrists, I'm going to have you make a fist again. And I'm going to push down, just a fist, yep. And I'm going to test your wrist strength up and down. Good job. I'm also checking your pulses, making sure these all look good, your radial, your brachial. Good. I'm checking fingernails, making sure we can blanch under 3 seconds, checking skin on our bilateral upper extremities. And now I'm going to put my fingers here. Can you grip my fingers and then try to pull them out? Or I'm going to try to pull them out. Good. So I'm testing grip strength doing that. So next we're going to look at your fingers. Can you wide out like this? I'm going to push against both sides. Good job. That's +5 on your strength. If we had wrist or hand pain, I could do the Tyndall sign. So I'm going to have you bring your arm out like this, and I'm going to tap. And if you felt any numbness or tingling, that would be a positive sign. And for the Fallon's test, I'm going to have you go like this and bring your palms out. Good. That looks good, and that would help diagnose carpal tunnel syndrome. You can relax. Next, I'm going to test your movement. Can you go like this back and forth? That looks good. You can relax, and I'm going to also have you do your finger to my finger into your nose. Yep. Good job. Okay, so next I'm going to use this Q-tip, and I'm going to touch you. I would have you have maybe just like a short sleeve shirt so you could feel it. But I'm going to touch, close your eyes, and tell me when you can feel it.
Shoulder. One.
Tell me where on your forearm.
In there. Outer.
Good.
Pinky.
Good. And I would do that on both sides. So I'm assessing when I do shoulder C4, forearm inner and outer C6 and T1, and then fingers C6 and C8. Next I'm going to do your deep tendon reflexes. So I'm going to do the bicep one. Can you relax? Good job. And I'll do this on both sides. Good. I'm going to do your the back side here for your tricep and your brachioradialis. I'm going to have your thumb up. I'm going to hit about 2 inches I'm watching your hand there. Good job. And that would be C6 and C5. And then the tricep is C6 and 7, and bicep is C5 and 6. All three look normal. Next, I'm gonna have you close your eyes and tell me what I hand you here. What is that?
It's a pin.
Good. And next, I'm gonna draw in your hand. Can you tell me what I draw?
6.
Good job. Next, I'm going to have 2 points and 1 point. I want you to tell me if there's 1 versus 2, okay?
2. 2. 1. 2.
Good job. And now I'm going to also tell me if I'm touching 1 spot or 2. With your eyes closed.
1. 2.
Good job. And that would be for point localization and then the 2-point discrimination. Okay, now I'm going to look at your lower extremities. Can you bring your, kind of bring your thighs up? Yep, and then down. Good. Push out against my hands, push in. Good. Push up against my hands, push down. Good job. That's +5 all around. We're going to do the Faber test. So I'm going to have you lay down. And I'm going to have you do a figure 4. So bring your leg out good. And I'm going to be pushing down while I kind of bring this up. Do you have any pain?
No.
Good. That's a Faber. And then I'm also going to do the leg roll. So I'm going to roll this leg in. Do you have any pain? Good. I'm going to have you sit back up. And we're going to do, I already pushed on for your knees, texted your extension and flexion. That was good. I'm checking your popliteal pulses on both sides. While I'm here, I'll check your dorsalis pedis, your what's it called?
PT.
Thank you, your PT pulse, and that all looks good. I could also check cap refill. I'll take the socks off, looking at color and looking at everything there. Next, I'm going to do the drawer test. So I'm going to have you lay back down. I'm going to have you flex your knee up. And so I'm going to push and pull right here. And that's just testing your knee. And then I would do the McMurray test, sorry. And I'm going to have you flex your knee in and your ankle out. So I'm going to have you kind of go like this. Good. Any pain?
No.
Good. Okay. Next, I'm going to have you lie on your tummy. Can you flip for me? And I'm going to do the Thompson test to look at your calf. And this is going to assess for plantar flexion in the feet. Okay, you can flip back over for me. Next, I'm going to do the taller tilt. So I'm going to have you bring your ankle kind of like inward, or this inward. Yep. Any pain? Okay, that looks good. I already palpated your pulses. I'm also going to, I did the Thompson test and the Taller test. I'm going to do your tendon reflexes, your deep tendon reflexes. So your patella tendon, this is L2, L3, and L4. Good. And those are +2. I could also do the back of the ankle one as well. And next, I'm going to have you do your walking. So I'm going to have you go to the door here for me. Pop down. Good job. I'm going to have you walk toward me, just normal. And then I'm going to have you walk back heel to toe.
Hold on, I don't see that there. I'll do it again.
That's okay. I'll just verbalize it. I'm going to have you go back on your toes, and then come back. On your toes and then on your heels. Good job. I'm assessing your gait, making sure you can do everything. And then I'm going to do the Thompson test. So I'm going to have you stand with your feet together right here. And then close your eyes. And I'm assessing this for 30 seconds to make sure we can stay still. I'm going to make sure you don't fall. Good job. So we've already seen you hop down. And next I'm going to have you step on this stool. You can step up for me. and that would be just to assess your gait and balance as well. And that's your exam. Do you have any questions for me?
Mm-mm.
Okay, good job.